You're for us in Kwa-Zulu this morning. KZN not quite in the third wave yet, luckily and hopefully, of course, we don't get there, but teachers still need to get their jabs in that part of the country. So important, isn't it?
That's right, Gareth. I mean, they are among those that are facing thousands of people every day, particularly those children that are going back to their families. The first of those teachers that are lining up to get their jabs have arrived. A handful of them are here at the Kwa-Zulu Indoor Sports Centre. Now, you'll remember when we spoke to the Education MEC earlier, one of the things that I'd asked him about was his response to one of the teacher unions, SATU, talking about how they were not part of the planning process behind getting this mammoth program together. So now I've got Nomarisha Kaluza from SATU. Ma'am, thank you for joining me. Now, I know that you were not happy, firstly, about how this process was put together. Let's start with your concerns, because the MEC has said that they wanted to have a plan before they had something to show to unions.
Thank you for the opportunity. You know, here in KZN, as we see things starting now, but it's true that we're not involved as unions, and we raised the concern with the MEC because the meeting was only convened on the 21st of June for a process that is starting today. And in districts, some of the districts never had meetings, and that is our concern, because when members are frustrated, when teachers are frustrated at the centers and not being attended to, they will be coming back to us as unions. That is why it is also important and very important that at all times the department be inclusive in its approach when dealing with issues that touch on many people like teachers. We are teacher unions representing them, but we are here at Kwa-Zulu, and we see that at least in this center they prepared, but we are worried about other centers because our regional leaders told us that they are not sure, they are not confident about what will be unfolding in those centers.
Tell me about what, if you had been involved in the process, what would you have done differently? I mean, we can't preempt anything yet to say that the process is not going to work, but what are some of the suggestions that you would have liked to have seen included?
Firstly, KZN being a rural district, the most important thing that we would have raised with the department is the number of centers in some of the districts, to say like Zululand district, which is vast, and King Echwayo, Umkanyakude. Those districts need to have more centers to avoid teachers and education workers traveling long distances for them to get to the centers, because that would mean that they have to spend, because sometimes they have to change two transport modes or yes, for them to get to the centers, and that is unfair, especially because even after the vaccine you don't know how you will be reacting, because not everyone has the transport of his or her own.
Do you think that's then going to affect the number of teachers that would potentially take the vaccine, not because they don't want to, but because perhaps they can't get there?
Definitely, it will affect, because we can't have a situation, for example, if we talk of Uku district. In Uku, we have the center in Potchefstroom city center, and then in Harding, others in Umzumbe. What about areas like closer to Port Edward? What about Nzimakwe? At Amachuba district, for example, we have two centers there in Newcastle and then Matadeni. What about Downhauser people? What about Utrecht? Those people are disadvantaged, and they will find it difficult to get to the centers.
I know it's early, and I'm hoping we can have a discussion about this later, but just as we wrap up, one of the things that you had said previously was that you anticipate that there might be chaos in some of these centers because of these planning issues, these teething problems. Will you be getting feedback, and when will we be able to hear about what's going on in other parts of the province?
SATU leaders are all over the centers, monitoring and observing, and we agreed that by 11 they must be submitting updates. They must be giving updates so that we know what is happening. But what is important for us, because we want teachers to be vaccinated, we want to understand the challenges so that we can timelessly engage with the department for interventions to be done. Because at the end of the day, it's sad we called for this vaccine. That is why we are so interested interested, and that is why we are so excited. But at least today it is starting, and our wish is that everyone can just avail themselves, and that is why we want the Department of Education, of course, working with the Department of Health to rethink and reconsider the number of vaccination sites in the districts.
Thank you very much. That's SADTU sharing their sentiments there. As I had mentioned earlier, they were not happy with this process. So as a result of that, they're also going to be monitoring how this program rolls out in the various districts in Kwa-Zulu Natal. One of the issues here, as you can hear as well, something that's it's often plagues Kwa-Zulu Natal when it comes to things like this, is the issue of long distances that need to be traveled. And in this case, it's teachers that will have to make those trips to get their vaccinations.
I'm so glad you actually raised the point, Des, and somebody just sent me a tweet a few moments ago actually asking about where are they doing these vaccinations. So let me just clarify, and I'm sure you can confirm this for me, that the vaccinations not being administered at schools. They're actually being administered at various vaccination sites. It's not being administered on any kind of school premises or school property. That's according to spokesperson Elijah Mhlanga. Des, and for the moment, thank you very much. We'll come back to you later to get more reaction, not just from unions, of course, but from teachers who are going to be getting the jabs. You would have heard Elijah Mhlanga as well. This question from Heidi Jokos, that what the situation is in the Western Cape at the moment. It was earlier suggested that the Western Cape had not received any jabs for their COVID-19 vaccine program for their teachers. Elijah Mhlanga here on eNCA is saying it's not true. He even has an email. He tells Heidi Jokos that the program is starting in the Western Cape today. We're going to confirm, we're going to follow up, and of course we'll bring you the latest on that as well.